Life Through the Spectrum, Part 2, an open letter from autism parents. Before we start, please remember that every child with autism is unique. This only represents some parental experiences, but can be used to educate and advocate for children on the spectrum. We know that autism is a spectrum disorder, meaning that children diagnosed can be mild, moderate, or severe, and anywhere in between. That in itself is what breeds anxiety for parents. Most parents spend every waking moment trying to figure out how to make their child's life with autism more functional, asking, how can we provide the best life possible for our child in our so-called twisted world that we all live in? Most parents are desperate for one simple thing, for their child with autism to be treated just like every other child. We just want to give them a fighting chance to blend into this crazy and chaotic world that even neurotypicals have difficulty navigating. Sometimes it seems impossible, but we refuse to give up. Some thoughts that may run through the mind of an autism parent. What happens when we are no longer here? Who is capable of taking care of our children? What happens when we are not around to advocate for them anymore? And does our world really understand autism? Honestly, unless you live with a child with autism, you will never understand it fully. But it is important that as a society, we try to understand. With rates of 1 out of 68 children diagnosed on the spectrum every year, and a prediction that the ratio will continue to rise, we need to understand more, and we need to advocate more. Truth. There are so many nights we stare at our children and see how perfect they are in so many ways. In that same moment, we may cry. It is so hard to watch our children struggle. It is heartbreaking that we cannot fix it and make it all better. Every day, autism parents watch their children battle to do things that are supposed to be innate in our development. Children on the spectrum may have self-injurious behaviors. Lack of speech and communication can lead to frustration. The child may hit themselves, bang their head on the floor, or even hit others around them. For some autism parents, this is an everyday occurrence to witness. When we see our children suffering like this, it is distressing and heart-wrenching. Children on the spectrum also have stimming behavior, which by definition is a repetitive behavior done by the child to cope with the environmental stimuli that is either overwhelming or too weak of an input to get the desired feeling. Typical stimming behaviors consist of jumping, spinning, hand flapping, repetitive vocal sounds, and blinking, to name a few. Can you imagine what it would feel like if you had the need to move nonstop, felt anxious from stimuli you encounter every day, and not have the ability to tell someone how to help you? Their under and overactive sensory systems can cause so much discomfort that the child may resort to self-injurious behaviors out of frustration, discomfort, and confusion. In these moments, we, as parents, feel sad and uncertain about our child's future, and even upset. It feels like we are being defeated by the disorder, unable to conquer it or fix it for our children. Regression is part of autism and can happen at any time, going from a normal happy baby to sudden regression, like someone turning off a light switch. While it is happening, there is absolutely nothing parents can do but watch the child that they once knew slowly slip away. Imitation, gone. Babbling, gone. Saying mama and dada, gone. Playing peekaboo, gone. Eye contact, gone. And new stimming behaviors starting. All of a sudden, our children are in a world of their own. Isolated into a world by themselves where they neglect to emotionally and socially interact with others. Fact, early intervention is the best intervention. So always push for an evaluation if you have concern. Therapy for a 2-year-old on the spectrum can range anywhere from a couple hours to 40 hours a week. Our children are busy, and we are busy trying to help our children attain developmental milestones that were lost and milestones needed to function in life. So yes, sometimes we feel depressed or sad because we watch our children struggle for what is so natural for other children to attain developmentally. Hours and hours of speech therapy to gain one word, or hours of learning how to play with toys in a functional manner. Teaching our children, step by step, something simple, like how to play with a toy car appropriately. All children on the spectrum are warriors. Their entire life is a battle. They fight day in and day out. Sometimes it may feel like we all are running a marathon. We wake up every day not knowing if breakfast will take 15 minutes or an hour, because as parents, we may have to reteach how to use a fork, or the texture of food may bother our child that day. We keep running and running and running and running and running until we hit a barrier, then another barrier. There's always a doctor telling you we don't know what else to do, or a professional that's not really listening when you've been on a wait list for 12 months to see them. It can be frustrating and overwhelming. Autism means watching for so many other coexisting medical conditions. According to the National Autism Society, comorbid conditions often associated with autism include Fragile X, allergies, asthma, epilepsy, gastrointestinal disorders, viral infections, feeding disorders, anxiety disorder, bipolar disorder, attention deficit disorder, Tourette's syndrome, obsessive compulsive disorder, sensory integration dysfunction, sleeping disorders, immune disorders, autoimmune disorders, and neuroinflammatory disorders. Needless to say, the doctor appointments can be endless, and our children are always on a busy schedule to remain healthy and complete the therapy needed. Most parents of children with special needs are grieving in some kind of way. They may be coping with the idea that their child may never talk, may never have a boyfriend or girlfriend, or may never be able to live on their own or drive a car. It's natural to think of the future and what could have been. The best thing to do is to stay positive, take one day at a time, and celebrate the small accomplishments that happen every day. If you know someone with a child with special needs, cut them some slack. They are doing the best that they can. If you know a child with special needs, view them as amazing. Think about all the hard work they have to do on a daily basis and the profound journey that they are on. If you are blessed to have a neurotypical child, teach them about children with disabilities. And please teach them that these children are just different, not less. Different, not less. That children with disabilities should be treated equally. Don't feel sad after getting a glimpse into the life of autism. Feel educated and continue the advocacy process in whatever way you can. This has been Life Through the Spectrum, an open letter from autism parents.